Hello and welcome to this episode of GIANT's Healthy Innovators TV. My name is Barry Shrier and I'm your host. What we like to do is we like to bring to you leaders in healthcare, innovation, and technology, people who are at the forefront of creating new services and new tech innovations in healthcare. We are all sharing the same vision, which is to improve the health and well being of people around the world by supporting and facilitating innovation and the adoption of new technology to enable clinicians around the world to deliver better healthcare outcomes at lower cost. Once again, my name is Barry Shrier. I'm your host. And today I'm delighted to introduce you to Tim Ringrose from Cognitant. Hi, Tim. How are you?
Hi, Barry. Yeah, very well, thank you.
Excellent. Nice to see you. And obviously, thank you very, very much for joining us. I'd like to add for all of our listeners around the world, Tim and his business Cognitant have been extremely valuable sponsors and supporters of Giant Health over the years. So to begin with, Tim, thank you. You know, we've loved working with you and we're grateful for your ongoing partnership with us. Thank you very much for that.
Great. Well, we're pleased to be part of it.
Excellent. So, healthcare is a big, complicated, challenging world, as all of our listeners and viewers understand. But Tim, to begin with, you know, we love the human interest elements of healthcare. So, if you don't mind, we're going to be talking about eradicating the knowledge divide, so to speak, how to address health inequalities. But before we dive into that, you know, you're the CEO of one of the leading companies in patient engagement. What inspired you to kind of launch Cognitant to get it off the ground?
Yeah, well, I suppose it all harked back to my training as a clinician. I trained in renal medicine and intensive care in Oxford. And, I love clinical medicine, but I always felt that a frustration that it was very difficult to communicate with patients in a way that meant that they left the consulting room or hospital with a full understanding about their health, what
Yes.
investigations they'd had, what treatments, and of course, what lifestyle changes they could make to achieve better outcomes.
Mm,
So I was really motivated to see how could we address that. My career started as a clinician. I then kind of took a left turn. I got involved when a friend started a physician networking service called Doctors Net UK and stayed
right.
with that a lot longer than I ever thought I would. But it was
Uh-huh.
a very exciting journey, and then ended with an acquisition by M3 Inc., a Japanese listed health tech company. I stayed on with that company for a while. Had a great time, but learned a lot. But I really felt a pull really to go back to that need of how can we provide people, not just patients, but everyone, with
Mm,
better health information that was accessible, that was trustworthy, and that was
yes.
personalized.
Yeah. Yeah. Excellent. Was it daunting? How did you actually directly leave what you were doing before and launch Cognitant?
Well, I think always you look back at times when you embark on new adventures, and
Sure.
you sometimes wonder, how did I have the guts to do it then? But at the time, you often just think, well, why not? It's time for me to do something afresh. Um, it was a little bit of uh, a daunting step, leaving a comfortable job that I knew how to do it and was quite exciting in its way. But
Yes.
I really felt that the time was ticking, and that if I didn't push myself off and do something new, then the risk was I would never do it. So I kind of forced myself to do it, and of course had the discussions with my family, and they realised that it might not work, but it was worth
Yep.
the risk.
Yep. Yeah. Excellent. No, that's very, very interesting. And I think that echoes an awful lot of experiences that leaders in healthcare and tech innovation in particular have. The fact that obviously you have that foundation as a clinician, which of course is extremely important. You know, you have firsthand direct knowledge of what has worked, what has not worked, where the challenges are, and so forth. So that's interesting as well. Hey, well, look at so you guys are focusing on addressing health inequalities through knowledge. That's a big part of your company mission, isn't it? Could you expand on that? You know, what are examples of what you guys are doing?
Yeah, well, I think it's a really sad state of affairs, but in fact, although life expectancy has increased over the last few decades in the UK. It's, since the 1940s, since the Second World War,
Yep.
it's improved a lot, and average life expectancy is now just over 80 in the UK. And we
Yep.
don't rank badly compared to other countries. We're actually pretty good. But
Sure.
but the sad state of affairs is that Britain actually has a huge inequality in age of death, and so
All
that
right.
that that means that there's a great variation depending on what part of the country you live in, and your educational background, and your economic status.
Hmm.
That's a very sad reflection. It's also the case in the States. So, in fact, in some cases, in some regards, the US is worse than the UK. So we don't have
Yes.
a very equitable society when it comes to health.
Could you elaborate on that? What exactly is the inequality?
Well, I mean, there I was talking about life expectancy, so the age at
Right.
which you die is in. But I
Right.
think there's a much more important thing, and what if you just look at the age of the lifespan, the risk is that you people live longer, but they actually don't live a healthy life, and they might spend the last 10 or so of their years in a bad situation, of ill health. So I think
Yes.
what we really need to think about is healthy lifespan, and how long are we living in a state of positive, good health.
Yep. Yep.
And we know that there are big variations there. For example, we know that uh, if you look at long-term conditions, those who are in the more deprived sectors of our society, lower socioeconomic status, will generally develop long-term conditions up to 10 years before those who live in more affluent areas. So
Wow.
that's a
Wow.
massive difference. And of course,
Hmm.
that then means that they have a much longer part of their life in ill health,
Yes.
and they also have a shorter life. So they have both shorter lifespan and shorter healthy lifespan.
Yes. Yeah. So it's a negative double whammy, so to speak.
Yeah, and of course the terminology for this is really, and I think there's a lot of attention on the social determinants of health. And so,
Yep.
what we're becoming increasingly aware of is that these social factors have a huge impact on a person's well-being, and we need to correct that. But what's really interesting is that when we look at how to deal with social determinants of health, of course, giving people better housing, giving people higher incomes, giving people better access to healthcare, they are all very really important.
Yep.
But it's increasingly being recognized that information is an independent determinant of health. And so, in other words, you can counteract social determinants, social deprivation, with
Right.
good information. So you're giving people the tools to help themselves, basically.
Oh, okay. Well, that's interesting. I haven't heard so much about information itself being a, how do you say it, an impactful element of health inequalities. Um, I guess we know that with digital health, it's hard to reach everyone, isn't it?
Yeah.
So I understand information is a cornerstone theme here. But how do you aim to reach as broad of an audience as possible? Are there issues and challenges there? What are you guys doing in that area?
Yeah, well, it's another interesting fact that when you consider health information,
Right?
I mean, this is a bit simplistic, but you can think of information as either being good or bad. So the
Okay.
good health information is stuff that we're comfortable is accurate, that it's evidence based, and that
Yes.
will help people to manage their health more effectively.
Okay.
But there is also bad information or misinformation or sometimes disinformation, which means it's purposefully created to be misleading,
Yes.
which can be very harmful. And what we saw in the pandemic with COVID was that misinformation is not only harmful, but it also spreads much quicker than good information.
Hmm.
So
Hmm.
I almost think of it that it's not that there's a vacuum and we've got to provide information to patients to help them, or to people to help them help themselves. It's actually
Right.
there's an information war going on. The world is full of information. The internet has brought us access to so much information, but it's actually created a problem where there's so much information, it's really hard to know what to believe. And going back to COVID, I think that was a really good example of how you had that tension between good information and bad information, and a lot of people didn't know
Sure.
what to believe.
Yes. Yeah. No, that makes a lot of sense. Is that a new thing, or is that kind of evolving as digital communications and digital channels evolve and so forth?
Well, I think we're all becoming aware, or we are all now aware of misinformation, and I think when we look at the new age that we live in, the AI
Yep.
age, generative
Yep.
AI has the
Yep.
potential to create even more information, and with that, it brings more of a challenge about, well, what do you believe? Can you trust what Chat GPT tells you?
Yes.
We're beginning to realize no, it can't, and unfortunately, bad actors can use generative AI and other AI tools to amplify their influence.
Yep.
Whether
No,
you're
that's a very
thinking
good
about
point.
elections or thinking about healthcare, it's a concern that we need to address.
Yeah, no, that's a very interesting point. I certainly know that in very tiny, tiny pockets of knowledge where I have a fairly comfortable high level of understanding, the responses from the LLMs, Chat GPT, Google, Gemini, and so forth, are absolute nonsense.
Yeah,
Just shockingly nonsensical. And I'm not an expert in anything, but I have a little bit of expertise in a few tiny areas of interest to me. And when you seek information on these from these LLMs, it's shockingly, not like I said, nonsensical.
yeah, yeah.
Oh dear. Going back to about digital health, about information, like you said, I know this is simplistic, like you said, but good information. So, how do you reach as broad of an audience as possible? How do you do that equitably?
Well, I think what we've done, maybe this isn't the right way, but it's a way, is
Yeah.
that we've thought about, well, who do people trust, and how do we leverage that to disseminate good information? And
Oh,
so
okay.
we've built our platform, Healthy Note, as a way for clinicians, so nurses, doctors, pharmacists, others in healthcare, to be able
Yep.
to recommend good information to patients. And it's not only about recommending good information; it's also personalizing it. So
Yes.
a patient can, or a person can, receive like a playlist of information and other resources that their clinician, the person who they may have just seen, recommends to them, and that's been a really good start. And then what we're now doing is building on that, saying, well, how can we uh, provide additional information that's based on a person's medical record?
Right.
And that's a really exciting area of development, because if a person gives us permission to access their medical record through the
Yep.
NHS app, or through access to their primary care record, even secondary care record, then we can make the information even more valuable to them. So rather than them having to read generic information and trying to decide what's what's relevant to me,
Sure.
we can say this is relevant to you. And a great example of that is some work we've been doing with University College Hospital London for stroke patients.
Okay.
So when a stroke patient's discharged from UCLH, they get a personalized, almost like a discharge summary that is has been picked by the clinical team to be right for them. So it helps them to understand what kind of stroke they've had,
Right.
what investigations they've had, what neurological problems they had as a result of it, and what treatment they're on, and why they're on that, and what rehabilitation and support services are available for them as they go home.
Yes. Yeah. No, that's extremely interesting. And this is personalized from the patient's own medical records?
Yeah, so the first phase of the program was the clinicians were selecting using a web interface.
Okay.
We're building integrations into Epic, which is the EPR system used at UCLH, so
Okay.
we can start to pull that data out and reduce the effort of the clinician, so that the clinician can just check they're happy with it, but reduce the time it takes for them to be involved. Because I
Yep.
think one of the important things to think about when you're introducing any new technology into a healthcare system, or any system, is it's got to be ultimately good for the end user, but you've also got to think about all the other people involved upstream from it, and make sure that
Exactly.
their involvement in it is as easy as possible and doesn't take any
Mm,
extra time or
mm,
complexity.
mm. So, this, program at UCL that you mentioned, is that live? Is this a trial? Where are you with that?
Yep, it's live. It was funded by SBRI, so we're very pleased to get some grant funding for that.
Oh, nice.
Yeah,
Congratulations.
thank you. Yeah, and we've just completed the second phase of the program. So
Wow.
evaluation with more than 500 patients.
Wow.
And that program's now extending into other acute stroke centers throughout the UK.
Yeah. Oh, superb. Could you share with us? I don't know if this is confidential. If it is, of course, no worries. But can you share with us what kind of results are you guys seeing?
Yeah, well, the main things that we've been able to detect at this early stage are patient satisfaction and the increase in patients' knowledge about their condition, having
Okay.
participated in it. So
Yeah.
we've seen really high rates of patient satisfaction, 90% or more, and we've
Wow.
seen a dramatic uplift in people's understanding about what's happened to them. So,
Yes.
roughly speaking, it was about 31% before the program, and it's now 88, close to 90%. So that's a huge change in people's understanding about stroke and what's happened to them. And it's not
Yeah.
just the
Those are
patients themselves, that's also reflected in carers. So carers and family have also found that it's been very beneficial for them to
brilliant.
understand what's happened to their loved one or the person they're caring for, and what they can do to support their recovery and rehabilitation.
Yeah. Yeah. You quoted two numbers, a 30 something percent and an 80 something
Yeah.
percent. Could you explain that a little more? What are those percentages representing?
Well, we asked patients before they took part how much they understood what had happened to them, and
Okay.
we found that only 31% said that they had a good understanding of what had happened to them. So, in other words,
Okay.
70% said they didn't have a good understanding of what happened.
Yeah.
They,
Yeah.
they, they were confused, bemused, and perplexed about what's happened to them.
Sure.
After we implemented the program, that rose the number who said they had a good understanding or excellent understanding rose to 88%, so that we had the vast majority now saying that they had a good understanding of what had happened to them.
Exactly. That's a dramatic change, isn't it?
Yeah,
And,
really good to see,
yeah,
um, and that's an important first step, because it shows you've got something
sure.
that has an impact. But we know that we've also got to demonstrate an improvement in clinical capacity, because for new technology to be adopted in the NHS or in any healthcare system, it's not good enough to be just good for patients. You also have to be able to demonstrate either a cost saving or a capacity improvement.
Right. So, how will that be measured? Is that something you're measuring already, or you're in the middle of measuring?
Yeah, we're starting to measure that, and we've got some funding from NIHR to take this program further. And we'll be doing a randomized controlled study with the University of Birmingham to look at the impact of the stroke program, in particular for one of the most common symptoms that stroke patients have, and that's fatigue after stroke.
And could you repeat, what are those 2 things that you said? Obviously, the patient, element of this is extremely important, but you said there was 2 other issues. One was, cost savings, is that right? Or and one was what? Some kind of clinical, measurement?
It was increasing capacity. So, when you talk to any of the leaders in ICSs these days, there's a huge concern about capacity.
Absolutely.
We've got a workforce crisis, which I don't guess we'll go into today. We've
No.
got increasing demand from the
Yeah,
population,
yeah,
so there's a mismatch. So how are we going to deal with the growing demand on our health services with the limited staff that we have and the limited resources?
yep,
And so, we need solutions that are going to either save us money so that we can put money elsewhere, or just as important, perhaps even more important, save capacity, reduce capacity, or increase capacity by reducing the load, so that our clinical teams can deal more effectively with the demands on them.
yes, yeah. How do you feel that your platform or, services will fare in these additional measurements?
Well, already we're getting really good reports from both primary and secondary care clinicians that using Healthy Note to provide information to patients saves time. If
Mhm.
you just think about a typical consultation in general
Yep,
practice, for example, you know, unfortunately, patients are often having to wait quite a few weeks for their appointment, so they turn up to
yes,
they turn up their appointment with a lot of anticipation and often a long list of questions, um,
sure.
and the appointment's only very short. So how does a GP deal with all these questions in a very short space of time? I think the average GP consultation is something like 8 minutes. And so
That's right.
being able to use Healthy Note to say, okay, well, we've talked about this. I've just arranged for you to have either, some investigation or treatment for that. You've got some other questions. I'm going to send you some information. Look out for a text message or an email. I'm going to send you some information that's going to help you understand what's going on there.
Yes.
That
Yeah.
saves time. So that's a really good demonstration of how information prescriptions, as you call them, uh, can be time saving and improve clinical capacity.
Yes. Yeah. No, that's extremely interesting. Where do you see this going? Like over the next few years, do you guys have a fairly clear roadmap, or does it depend on a lot of elements of the how do you say it, the whole healthcare system and where that's evolving?
Yeah, we're very focused on long-term conditions, and we've started
Yeah.
with chronic kidney disease, stroke, and we're moving into other cardiovascular diseases like hypertension, heart failure, atrial fibrillation, and other arrhythmias. But I think what's also very exciting is that I think there's an opportunity to bring health industry together to work with health insurers and health providers to really focus on the needs of patients, because there's a lot in this for industry. Industry traditionally, so I'm talking about pharma companies, don't have much contact with patients. Occasionally
Yes.
a lot of companies will have a patient expert, but in general there are a lot of barriers between a pharma company team and patients. And so, what we can do is we can help them to get involved. We can help them to understand the needs of the healthcare providers. We can help them to be part of the provision of good information, and not just information, but also digital tools to patients. So, our mission really is to be bringing together industry, health insurers, and providers together to work together to say, how do we provide the best services for patients so that patients can um, be empowered to understand their own health, to work proactively to avoid ill health, and
Yes.
if they do develop a chronic condition, to make sure they get on the best treatment at the right time as soon as possible to avoid deterioration of their condition and to avoid complications, which of course has a benefit to reducing the load on the NHS. If you take
Absolutely.
type 2 diabetes, for example, we work with a pharmaceutical company and we've built a product for type 2 diabetes patients to reduce the risk of developing kidney problems.
Oh, okay.
So, if we can do that, then we can stop patients in the future developing kidney failure, which then might require dialysis, which is incredibly expensive, or need a transplant. So, that's a very kind of, just one example of how
Sure.
we
Yeah, no,
can
that's a
bring.
superb, absolutely superb example. And I guess that's part of a broader theme, isn't it? The theme of trying to encourage citizens nationwide and internationally to lead healthier lives, to sort of take ownership of their health. And so I guess the theme of prevention rather than reactive treatment is quite fundamental for healthcare systems, isn't it?
Yeah, and prevention is so important. Unfortunately, prevention often gets left last on the list and doesn't
Sure.
get a lot of funding. Prevention doesn't hasn't been getting a lot of funding in the NHS in the last 10
Yeah,
years,
yeah.
for example.
Yeah.
Um,
Yep.
but as they say, a stitch in time saves nine. Um, it's actually also hard to demonstrate the cost savings of prevention because it often takes a while for it to wash through. And unfortunately, a lot of our budget cycles are quite short, and so people are looking for very sort of in-year savings. So they're looking for a benefit of a spend within the next 12 months.
Yep.
But of course, I think people are beginning to realize that we need to think a bit longer term, and that if we don't do invest in prevention and think about the longer term, we're just going to end up with a huge, ever growing burden on our healthcare system.
Exactly. Yeah. Which of course is unsustainable. And
It is. We spend something like $9 trillion on healthcare globally. It's crippling economies, and we can't simply just chuck more and more money at it. We need to think of more innovative ways to manage our health.
well, exactly. Yeah. But that's where you guys come in happily. And so I think we've covered off an awful lot of stuff today, but I'm not in any rush to wrap up. But I'm just wondering, Tim, are there other things you'd like to cover off? Also, naturally, as you know, we are an international community, the Giant Health
Yeah.
community. So I'm only curious if you have any asks. Are you guys recruiting? Are you looking to raise money? Anything you want to talk about regarding your business that perhaps some of our viewers, both in the UK and internationally, might be interested in, or opportunities to engage with you, for example?
Yeah, well, I mean, there's two things, I guess. We are fundraising at the moment, so always
Yeah,
happy to hear from people who want to get involved and support
yeah.
the
Let me get my
development.
wallet out.
Yeah,
Yeah, yeah.
and the second thing is that we do see opportunities in international markets.
Oh, okay.
There's a need for better information and digital tools across the world for low income countries, middle and high. And so we're always interested to talk to potential partners about how we can work together to really crack some of these knotty problems in healthcare. We already work in different languages, um,
Okay.
but we're keen to see how we can work with others, and we've built our Healthy Note platform specifically to not only distribute programs that we build, but also
Right.
programs from other people, from third
Oh,
parties.
okay.
So yeah, I'd be very keen to hear from anyone who's got a good solution for patient care and would like to work with us.
Excellent. So, for example, if there would be what other, how do you refer to them broadly? Content providers,
Well,
you'd be open to collaborating with them?
yeah, we already work with 90 patient groups, so content providers, but also digital service providers, health apps. Our platform is built to distribute all of those. So it's about information, but also digital tools and services.
Yes. Yeah. Excellent. Well, if that's the case, then obviously there would be huge opportunities, I think, to collaborate with a wide range of people in the Giant Health community. So that's something we would love to explore and grow with you.
Great, yeah, marvelous, yeah,
Perfect. Hey, well, look at this has been a fascinating conversation from my perspective.
yeah.
And
Thanks. You too.
Tim, obviously, we're very, very grateful for your time. Once again, obviously, we've loved working with you and Cognitant at our annual healthcare events in London over the past few years, and very keen to continue growing that. Um, we'll summarize now, if that's okay. Although I've certainly enjoyed this conversation and would love to continue it. Maybe we could do another episode later in the year to hear
Yeah,
about how
love
some
to.
of the things
Yeah,
that you've been developing are panning out.
yeah, I'd love to do that. Yeah. So presumably you'll do a bit of an edit and give us a preview of it so that we can have a look at it.
Absolutely.
Yeah.
Yeah, yeah.
Hopefully there won't be
So,
too much for you to edit out.
no worries. So, Tim, we'll wrap up now if that's
Right.
okay.
Yeah, that's good.
Thank you once again for your time. This has been Dr. Tim Ringrose, who's the founder and CEO of Cognitant. And we've been delighted to hear from you, Tim, and hear more about your interesting and important innovations at Cognitant. For everybody who has been viewing this episode, you can learn more about Cognitant in the links below. Obviously, we exist to serve the international healthcare tech innovation community. So thank you to all of our viewers from around the world. If you like these films, don't forget to like and subscribe to our YouTube channel. If you have any questions or comments for Tim Ringrose, obviously, once again, there'll be links at the bottom of the video here. And you're also invited to contact us directly if you'd like an introduction to Tim and his team at Cognitant. So thanks again, Tim. Great to see you. And this has been this episode of Giant's Healthy Innovators TV. As a reminder, if you go to our website, www.giant.health, you can learn more about our community. And we invite all of our viewers to consider attending our event, which is on the 9th and 10th of December in London, England. So hope to see as many of you there as possible. Thank you once again, and all the best. Thank you.
Thanks, Barry. Thank you, Giant.